the world watched as MPox, a disease once confined to certain regions, began to spread globally. This outbreak, declared a public health emergency in 2022, highlighted the interconnectedness of our world. Understanding MPox, its transmission and prevention is crucial for individual and global health. This essay aims to equip you with the knowledge to navigate this new health challenge. The World Health Organization, or WHO, defines MPox as a viral zoonosis. This means it's a disease that can spread from animals to humans. While rodents are suspected to be the primary animal reservoir, human-to-human transmission is a significant concern. The virus belongs to the orthopox virus genus, which also includes the smallpox virus. MPox, like many viruses, comes in different forms or clades. These clades, identified by Roman numerals I, IIIA, IIB, possess unique genetic characteristics. Clade 1, primarily found in Central Africa, is associated with milder illness. Clade 2, responsible for the recent global outbreak, is further divided into IIA and IIB. Understanding these clades helps scientists track the spread and develop targeted interventions. MPox was first identified in 1958 in monkeys used for research. However, the first human case wasn't recorded until 1970 in the Democratic Republic of Congo. Since then, outbreaks have occurred sporadically in Central and West African countries like Nigeria, Cameroon, and the Central African Republic. The virus remained largely contained within Africa until 2004, when an outbreak occurred in the United States linked to imported animals. In 2022, a significant global outbreak, primarily driven by Clade 3b, emerged, affecting countries in Europe and North America, marking a shift in the virus's geographic reach. Section 5. Recognizing the signs. Symptoms of MPox. MPox typically presents with a range of symptoms, often starting with a flu-like illness. Fever, chills, headache, muscle aches, and fatigue are common initial symptoms. Swollen lymph nodes, a distinctive feature of MPox, can appear before or during the rash. The characteristic rash, often painful and itchy, evolves through stages. It starts as flat red lesions that develop into pus-filled blisters and eventually scab over. Section 6. How MPox spreads. Understanding transmission. MPox primarily spreads through close contact with an infected person or animal. This contact can be direct, like touching skin lesions or bodily fluids. It can also be indirect, through contact with contaminated materials like bedding or clothing. While less common, respiratory transmission through droplets during prolonged face-to-face contact is possible. Section 7. Who is at risk? While anyone can contract MPox, certain groups are at higher risk. Close contacts of infected individuals, including household members and healthcare workers, are particularly vulnerable. Men who have sex with men have been disproportionately affected in the recent outbreak, highlighting the importance of targeted public health interventions for this community. Section 8. Diagnosis and treatment of MPox. Diagnosing MPox involves a combination of clinical evaluation and laboratory testing. Doctors consider symptoms, travel history, and potential exposures. Confirmation requires PCR testing on samples taken from skin lesions. While no specific treatment exists, most cases resolve on their own with supportive care. Antiviral medications may be considered for severe cases or individuals at high risk of complications. Section 9. Protecting yourself and others. Preventive measures. Preventing MPox hinges on breaking the chains of transmission. Avoid close contact with infected individuals and animals. Practice good hand hygiene by washing your hands frequently with soap and water, or using an alcohol-based hand sanitizer. Vaccination, while not widely available, offers effective protection and is recommended for individuals at high risk of exposure. Section 10. Staying safe in a world of MPox. As we navigate the evolving landscape of infectious diseases, staying informed is crucial. Understanding MPox, its transmission and prevention empowers us to make informed decisions. By following public health recommendations, practicing preventive measures, and supporting vaccination efforts, we can collectively work towards a future where MPox no longer poses a global health threat.